All right, let's get right into it. As you prepare to become clinicians, you're getting ready to face some of healthcare's biggest challenges. Well, today we are talking about one of the giants, hypertension. And I want you to think of this not just as a condition, but as a massive, silent epidemic that you will be on the front lines of fighting.
Let's just kick things off with a number to really set the stage. 1.28 billion. That is the staggering number of adults worldwide who are living with hypertension right now. It's a huge figure, and it tells you immediately that we are dealing with one of the most widespread and critical health issues of our time.
So what is this condition that's affecting over 1 billion people? Well, hypertension is, simply put, persistently high blood pressure. Specifically, we're talking about a systolic reading of 140 or more, or a diastolic reading of 90 or more. But honestly, the most important part of this whole definition is its nickname, the silent killer. And why is that? Because for most people, there are absolutely no symptoms. It just quietly wreaks havoc on the body for years.
To really get a handle on this, here's how we're going to break it down. We'll start with the sheer scale of the problem. Then we'll dig into why it happens. We'll see what it does to the body, learn how to find it, and then lay out our counterattack. And finally, we'll zoom out to look at the bigger public health picture.
Okay, first up, let's really wrap our heads around the size of this epidemic, and we'll focus in on the situation here in India.
In India, we're looking at nearly 1 in 3 adults having hypertension. But check this out, because this is where it gets really telling. You see that clear difference? In rural areas, it's almost 28%, but that number jumps to nearly 34% in urban centers. That's a huge clue, right? It strongly suggests that our modern lifestyle, things like stress, processed foods, sitting at a desk all day, is a massive driver of this epidemic.
And it's not just a human cost. There's an enormous economic price tag. The burden of hypertension on the Indian economy is estimated at 1.8 lakh crores every single year. So you see, this isn't just a health crisis, it's a massive drain on our country's resources, affecting everything from productivity to development.
And just to put it all in perspective, the World Health Organization doesn't mince words. They state very clearly that hypertension is the #1 cause of death and disability on the entire planet. That sentence alone should tell you why becoming an expert on this is absolutely non-negotiable for your career.
So when you're faced with a problem of this size, the next logical question is, why? Why is this happening? Well, the risk factors really fall into 2 big buckets, the stuff we can change and the stuff we can't.
Now, this is where you, as a clinician, become so much more than just a prescriber. This is where you become a counselor, because these modifiable factors, they're almost all about lifestyle. Diets loaded with salt, not getting enough exercise, obesity, smoking, drinking too much, these are the main culprits. This is where your advice can literally empower your patients to take back control of their health.
Then, of course, there's the other side of the coin, the things we're stuck with. We can't stop getting older, we can't change our family history or genetics. Knowing these factors isn't about intervention, it's about identification. It helps you pinpoint exactly which patients are at higher risk and need to be screened earlier and more often.
So what happens if this silent killer is left to its own devices? What does it actually do to the body over time? Let's take a look. The journey of untreated hypertension is, unfortunately, pretty predictable. It kicks off with prehypertension. That's the body's warning shot. If that's ignored, you move into stage 1, where the silent damage really starts. Stage 2 is when that damage kicks into high gear, and it all leads to the final, devastating stop, target organ failure. And when we say target organ failure, what are we actually talking about? Well, it's the big ones. The heart, the kidneys, the brain, even the eyes. We're talking about heart failure, chronic kidney disease, stroke, dementia, even blindness. You see, the price of silence is incredibly, incredibly high. This brings us to a huge practical question. If it's silent, if it's invisible, how on earth do we find it? This part is all about diagnosis. You know, the single biggest hurdle in diagnosis isn't a fancy test, it's awareness. Just think about this for a second. More than half the people in India who have hypertension have no idea. They're just walking around with it. This is why opportunistic screening, just checking a blood pressure every single time you see a patient for any reason, is one of our most powerful public health tools.
Okay, so once you get that reading, this table becomes your roadmap. These are the JNC8 guidelines, and you have to know them by heart. They give you a crystal clear, standard way to classify your patient's blood pressure, from normal to prehypertension all the way to stage 2. And this classification is what will directly guide your entire management plan.
All right, we've found the enemy, we've classified it. Now, how do we fight back? Let's get into the counterattack plan.
Your strategy for managing hypertension will always stand on two main pillars. The first pillar, the foundation for every single patient, no exceptions, is lifestyle modification. For a lot of people, this alone can do the trick. The second pillar, medication, is what we add on top when those lifestyle changes just aren't enough or if that initial blood pressure reading is just way too high.
It is so important that you know these first-line defenses inside and out, because this is the core of your patient counseling. We're talking about weight reduction, getting that BMI below 25, adopting the DASH diet, that's the one rich in fruits and veggies, slashing salt intake, getting at least 150 minutes of moderate exercise a week, and finally, moderating alcohol. These 5 steps are your most powerful tools before you even think about writing a prescription.
Okay, for our last section, let's zoom out from the individual patient in your clinic and look at the big picture. How do we win this war on a national scale?
You see, a real public health victory isn't just about treating sick people. It starts way earlier. It starts with primordial prevention. That's promoting healthy habits from childhood. Then you have primary prevention with screening, secondary prevention through early treatment, and finally, tertiary prevention, which is all about managing complications to prevent long-term disability.
And here in India, you're not fighting this battle alone. You've got some serious backup. You've got the MPCDCS, which gives us population-level screening and even free medicines. You've got Ayushman Bharat, which provides that crucial financial safety net. And then there's the Jan Austri program, making sure that generic drugs are affordable for millions. Knowing how to plug your patients into these programs is a key part of being an effective doctor in India.
But despite this incredible arsenal, despite everything we know about this disease, I want to leave you with a number that really matters today. 12%. That's it. Only 12% of patients in India actually have their blood pressure under control. It's a shockingly low number, and it tells us there is a massive gap between what we know and the impact we're having.
And so, that brings us to the final question. But this one isn't for me to answer, it's for you. Given everything we've just talked about, the scale, the causes, the damage, and the tools you have, how will you, as a future doctor, help change that number? That's not just a question, that is your challenge, and it is your opportunity.